Why YouTube has blocked anti-vaccine content. So far, YouTube has already removed over 130,000 videos for violating COVID-19 vaccine policies. On Wednesday, YouTube announced it would be expanding its medical misinformation policies with new guidelines on vaccine, which includes vaccines that work against COVID 19 as well as general statements about other vaccines as well. The move comes amid criticism that social media platforms are not doing enough to tackle misinformation related to COVID 19. What kind of misinformation is YouTube targeting? According to the new policy that came into effect on Wednesday, any kind of content that says approved COVID 19 vaccine caused autism, cancer, or infertility, or claims substances in vaccines can track those who receive them will be removed. Further, content that falsely alleges that approved vaccines are dangerous and cause chronic health effects or claim that vaccines do not reduce transmission or contraction of disease or contains misinformation on the substances in the vaccines will be removed. In a blog post, YouTube said its community guidelines already prohibit certain types of medical misinformation, including content that promotes harmful remedies like information that drinking turpentine can cure diseases. Since the pandemic began, the platform has already been targeting COVID 19 and medical misinformation. So far, YouTube has already removed over 130,000 videos for violating COVID 19 vaccine policies. What kind of content is treated as misinformation by YouTube? When it comes to COVID 19 related content, YouTube treats the following as misinformation. Content that encourages the use of home remedies, prayer, or rituals in place of medical treatments, such as consulting a doctor or going to a hospital. Content that claims that there's a guaranteed cure for COVID 19. Content that recommends use of ivermectin or hydrochloroquine for the treatment of COVID 19. Claims that hydrochloroquine is an effective treatment for COVID 19. Categorical claims that ivermectin is an effective treatment for COVID 19. Claims that ivermectin and hydrochloroquine are safe to use in the treatment of COVID 19. Other content that discourages people from consulting a medical profession or seeking medical advice. One of the possible reasons for YouTube's decision to expand its misinformation campaigning is vaccine hesitancy, especially across the United States. As per a survey conducted by Pew Research Center, Democrats in the US are far more likely than Republicans to have received at least one dose of a COVID 19 vaccine. This survey also states a person's vaccination status is strongly linked with confidence in the vaccine research and development process. About 81% of the respondents of this survey said they didn't know if there were serious health risks from COVID 19 vaccines, and 80% said public health officials were not telling them everything they know about these vaccines. Thank you.